Aloha and good afternoon. Thanks for tuning in to this special Hawaii News Now digital stream. I'm Dylan Ancheta in the H&N Digital Center. State officials are holding a news conference right now to discuss the end of the COVID-19 public health emergency. Let's send you there live.
To the traditional healthcare market, and we'll learn more about that today. During the PHE, the Department of Health led the response to protect the health of the people of Hawaii. Now, I would like to take this opportunity to recognize all of the DOH staff who worked tirelessly to support our community. There were numerous critical partners along the way, including the support from the then governor and lieutenant governor, the legislature and the counties, healthcare providers, the National Guard, and too many other community organizations to name. But the biggest mahalo goes to the people of Hawaii who wore masks, got vaccinated, and took other steps to care for one another as a community. Decisions to protect public health are not without secondary effects, and many experienced hardship and sacrifice. Nearly 1,200 Hawaii residents died from COVID-19, but it could have been much, much worse. Although the PHE is ending, COVID-19 has not gone away. We must remain vigilant for changes to it and for other future threats. It is extremely important that we continue to invest in public health preparedness. But we are grateful today to have the governor join us to acknowledge this milestone and provide a few comments. So thank you, Governor, for all of the leadership that you have provided during this pandemic, and you're critical to our success and where we are today. Mahalo.
Aloha. This is an important day. I remember deep in the depths of COVID, walking in the corridors of Queens Hospital when the Delta variant was there and among us. They had 7 wards that were filled with individuals that were intubated or severely ill with COVID. And as we walked by one of the rooms, a woman came out in tears. Not an old woman, somewhere in her 50s, tears gushing down her face, and we thought the worst for a moment, that she had just lost a loved one. Turns out the opposite had just happened. Her daughter had just been extubated. The breathing tube had just been taken out because she was now getting better. And the brave nurses at that particular hospital, Queens, had just helped her come through that process, and she was going to live. And I remember the look on the face of all of the nurses and the doctors, the respiratory therapists, just how much joy they had after watching her suffer. And that scene played out dozens and then hundreds and thousands of times over the course of the last 3 years. And so today I just want to say quickly, I salute all of the healthcare workers, all the people that sacrificed during the pandemic, the extraordinary people at the Department of Health, who really put in so many hours to make sure that as few people passed away as possible. But it was those moments in the hospitals, like at Queens, over at Straub, all across our state, HHSC, Kaiser, where people lived because during those dark moments, when it was at its worst, when the virus was strongest, they stood fast. So that was an extraordinary thing. So I mahalo Governor Ige, who helped get us through this pandemic, along with other people. There have been new mayors, and there was Mayor Caldwell. And, like Kenny said, other directors of health, epidemiologists, people who sacrificed greatly. And it was a really great challenge for all of us. So we mahalo everyone for understanding that this was a tough time. Now on the whiteboard, we wrote the number 4479 at the top. 4479 was the number of fatalities that we expected per year had we not intervened, had we not fought to make people mask up, to get vaccinated when the opportunity came, to socially distance, to stay home sometimes, to stay away from school. 4,479 people we expected to die each year if we didn't take action. And so what you did as a people in our culture to make sure we didn't spread the virus to our loved ones, or at the workplace, or at schools, that's what saved lives. So we thank you. In the end, More people in Hawaii got vaccinated than almost any other state. The number was 78.7%, got those first 2 vaccinations, which really made it safer to live. In the end, we did not see 4,479 people die. Far fewer passed away. And each life we lost was heartbreaking. Every story broke our heart. But to imagine that over 3 years, more than 12,000 people could have passed if no action was taken is an extraordinary testament to what people in Hawaii are and the values that we have when we care for our ohana. We had the lowest mortality rate in the country. And everywhere I go, when I talk to other governors, when I talk to the president, when I talk to directors of health or other strong leaders in health, they look at Hawaii and they're astounded at what this Department of Health did, what the people of Hawaii did, what the doctors and nurses and all the rest of you did to get us through. So I just say mahalo. Mahalo as your governor for making sure that we really put our love for one another ahead of all other challenges. Even in our times of conflict, at the end of the day, we looked out for one another. So I want to say you've been extraordinary. I'm going to turn this now over to one of our additional experts, but it really was something that we will never forget, and it made us stronger and brought us together more closely than we could have imagined. Aloha.
Good afternoon. With the end of the federal public health emergency, there are some changes and anticipated changes that we want everyone to be aware of. The Centers for Disease Control and Prevention and the U.S. Department of Health and Human Services have provided some information as follows. Vaccines will remain available. The U.S. government is currently distributing free COVID-19 vaccines for all adults and children, and this will not change at this time. We are all committed at DOH to continue working with our federal partners to ensure equitable access to vaccines as we move forward. COVID-19 at-home tests may not be covered by insurance. Insurance providers will no longer be required to waive costs or provide free COVID-19 tests, but the CDC's no-cost COVID-19 testing locator can help people to find current community and pharmacy partners who are participating in low or no-cost testing. Coverage for COVID-19 testing and treatment that is ordered by a healthcare provider will vary by insurance type. For people with Medicaid coverage, COVID-19 testing and treatment will remain covered at no cost through September of 2024. For those without insurance, free tests and treatment may be available at local free clinics or community health centers. Visit hawaiicovid19.com to locate no and low-cost testing sites near you. CDC will discontinue reporting of the COVID-19 community levels and some other nationally compiled COVID-19 metrics like test positivity. These changes are because of changing laboratory requirements and with the end of the PHE, and because case data has become less reliable as self-testing gains in popularity. Local Hawaii data will remain available and can be accessed through hawaiicovid19.com. So those are the messages we've received from our federal partners. I also want to talk a little bit about Department of Health's COVID-19 response efforts here in Hawaii, which will continue. The DOH will continue to partner with long-term care facilities, other healthcare and congregate settings, schools, and community organizations to provide technical assistance and education on how to mitigate the impacts of COVID-19. We will continue to reach out to some people diagnosed with COVID-19 to investigate outbreaks and to maintain situational awareness of changes in risk factors or outcomes related to COVID-19 infection. We will maintain public data dashboards that provide situational awareness of COVID-19 trends and impacts in Hawaii. Data will remain available on COVID-19 hospitalizations, deaths, wastewater testing, variants, and vaccination coverage. We will also continue to share available data on case counts, test positivity, and trends by county, age, and race and ethnicity. Over time, some of these indicators may become less reliable or less representative as fewer tests are performed and reported. DOH will continue to assess the value of these metrics and make changes to our dashboards in future if certain metrics are no longer valid or helpful. Finally, I want to say that while the federal public health emergency is ending, COVID-19 is not ending. Now is a great time to get up to date on COVID-19 shots. If you're sick, stay home and wear a mask when around others to avoid spreading disease. And remember that many people in Hawaii will continue to wear a mask as an everyday prevention measure. It is by working together and caring for each other here in this state that we've come through the COVID-19 pandemic as well as we have. Let's please continue to be mindful of everyday steps we can take to stay healthy. Thank you.
At this time, we're happy to take some questions.
Yeah, so just to be completely clear, will COVID tests and vaccines be available through the state in any capacity after today?
Yes. So COVID tests that are ordered through your provider are still going to be covered by insurance and still available at community health centers for those without insurance. It's the self-test kits that may not be provided for free through insurance companies going forward. But when you need a test, if you need to go to a provider to get a test, that's still covered. For vaccines as well, these are still federally distributed free vaccines, and providers that participate in our vaccine distribution program will continue to provide those for free at no cost to the person who gets vaccinated.
What's considered up to date for vaccines right now?
The latest vaccine recommendations simplify the schedule in some ways. I think the most important take-home point is that if you have not yet received an updated shot, a bivalent booster, you should get one. And that's true for everyone in all age groups.
So the at-home testing, are those still available at certain places for free? And also now that we're moving into this era where you may not be using them as often, are there concerns about people just having these at home and then they expire?
So this is definitely a good time to check your expiration dates on your home test kits. And there are websites where you can go to check if that expiration date has been extended. So for more information on that, visit hawaiicovid19.com.
We definitely noticed, I guess, in Hawaii, a lot more people just wearing masks anyway compared to other states. Would you say people are being overcautious, or how would you kind of characterize it now that we moved into this phase, or are people worrying maybe too much now?
I think that it's a very personal choice for a lot of people now, and we have to remember that in Hawaii we have many kupuna, and people are thankfully, people are very cognizant and wanting to be part of that larger ohana and make sure we're taking care of each other. So I do see a lot of people continuing to wear masks. Personally, for me, if I'm going through an airport, I'm probably always going to mask, not just because of COVID, but because of all the other respiratory infections one can get when traveling. So I think we have a new outlook on masking. And I do think some degree of masking is here to stay.
Do you have the most up-to-date case numbers and hospitalization numbers?
We do have a handout we'll be giving you today with all of the numbers on them. I don't have it in front of me right now, but yes, the dashboards will remain up to date. With no changes in cadence planned at this time.
I can tell you what those numbers are. So there's been an average of 63 people in the hospital over the last 7 days. That's been very steady for the last 6 weeks. We've ranged from about 55 up to about 70 in the hospital. We've had about 5 people on average in the intensive care unit over the last week. That number's also stayed very steady.
Governor, you made a point to write pandemic to endemic. What does that mean to you? What does it mean to the people?
So it means that we've moved out of the phase where it's affecting the whole world, the pandemic. And now endemic means it's a virus that will be here with us. I'm not sure if people remember, but in the early days as we wrestled with what COVID-19 was going to be, it became clear that it was about a 5-year experience for this kind of virus where you see it. Now, people will get COVID in 2023, they're going to get it in 2024, they're probably going to get it for several years if I'm not mistaken going forward. What I suspect will happen, this is kind of me with my doctor hat on, is I think people are going to get sick periodically and they're going to wonder, do I have a terrible flu? Do I have COVID? And they'll be able to get a test. They'll be able to see their doctor. And we will still have the same risk concerns. If you're older, if you've got chronic disease, we'll be more careful because COVID was very serious.
If future diseases arise with same about less than 1% mortality rate, will the entire state go into lockdown again?
I'd say we learned a lot. I would be surprised if that would happen. Also, we've now, as a healthcare team, healthcare community, Department of Health, developed a lot of extra experience on how we can best suppress a virus and its spread. It was very difficult in that first year when it got to be very prevalent. So I would be surprised if that happens again. I will tell you that in conversations with some of the nation's leaders, they're already preparing a plan that's very different. They're calling it a 7-1-7 plan, where they would spend 7 days isolating and figuring out what a disease was, 1 day communicating, and then having a 7-day acute response. Now, that doesn't mean you could contain anything in just 15 days, but we've learned so much that we're already in a space where we can begin to have those kind of conversations.
We know also, especially here in the Pacific, Japan was also one of the last nations to reopen. Do you think, given this declaration, we'll see that element of our tourism get back up to normal again?
We do expect that. Now, it's going to be gradual. It's not going to be just sudden. A couple things are happening in Japan. One is they're more cautious. They're very conservative. They're very safe. As you know, they wear masks even when there isn't a problem like COVID. That's number one. Number two, the yen has been weak for some time, and so it's difficult for people from Japan to travel. And third, they've been subsidizing travel within their own country because they've wanted to keep people home. So that's beginning to also fade away. But we do think that we're going to gradually see a steady return of the Japanese traveler, and that's good for Hawaii. We're reunited with a lot of dear friends that way.
One more for Department of Health, either Drs. Binkley and Hummel. For a big part of 2021, health experts called this a pandemic of the unvaccinated. What have you learned since then, and how will that affect your messaging going forward?
I think this is where, again, I have to thank everyone in Hawaii for the responsibility and the care everyone showed by stepping up and getting vaccinated early. I really do credit our statistics of having the lowest death counts in the nation to that early response, not just from Department of Health, but from our entire community. I think vaccination was an incredibly important part of making this a disease we can live with.
I just mean, it was in that 2021, it was like, if you get the vaccine, you won't get COVID, you won't spread COVID.
Yes.
Some more things were learned since then. So
yes.
Was that a little bit too quick to jump the gun back then?
I think there are so many ways where we've had to learn as we go in this pandemic. And I guess that's what we mean when we say a pandemic. It's a crisis, a public health crisis of a scale that no one has experienced in many of our lifetimes. So yes, there was a lot of learning along the way. We did learn that vaccine is not a perfect way to stop the virus in its tracks, but we did learn that it is very effective at preventing severe outcomes of COVID-19. So while it didn't completely stop transmission, it certainly made it possible to be able to interact together as we would like to in a more normal way and not fear for terrible outcomes.
We also learned during this process the importance of community engagement. And that was something good to come out of this, as we had developed so many new relationships with community partners and how important it is to maintain that community engagement. We learned the importance of data collection and data systems to really be able to understand which populations are at increased risk, to be able to identify and address any disparities. And the last thing is the trusted source of information. As this was developing knowledge, recommendations got updated as we learned more. So a big challenge is public health communication. And how do we maintain that trust, saying that this is the best decision with the information we have available at this time, understanding additional information will be gained and knowledge learned. So that's something as we go forward is to really focus on those three things as some lessons learned for how we can continue to invest in this public health preparedness, but really becoming a trusted partner with our community. Any other questions? Okay. Thank you, everybody. Call it. Thank you. Thank you very much.
That was a live news conference with the governor and other health leaders regarding the end of the COVID-19 public health emergency. As you could hear there, several changes in regards to essentially how COVID is handled. We do know that vaccines will remain free for the time being. However, testing and test at home kits may not always be covered by insurance. If a test is ordered by a doctor, policies may vary there from insurance to insurance. So either way, check with your medical coverage, check with your insurance, and see what you are covered for. But essentially, the governor is very hopeful here following that press conference that not only will we be able to better live with and cope with COVID cases in our community, but he's also hopeful that the economic boost will soon come back as Japan is lifting their restrictions as well. And so he's hopeful that there will be a gradual return from our friends over in Japan, of course, which is such an important part of our a boost to our economy, so to speak. We had a crew there at the press conference, and they will be working to bring you a full version of this story on later editions of Hawaii News Now, starting at 4 o'clock. We thank you so much for tuning in to this extended stream. Thank you, and have a great day. Aloha.